Hello, this is my audience. My name is Angela Johnson, and I'm here to tell you about a wonderful organization, which is St. Jude. Just imagine you had a child, and you just found out that your child had cancer, and you were not able to pay for the treatment for the cancer. But this wonderful organization would be the perfect organization to assist you with that. Now I'm going to tell you some quick facts about St. Jude. St. Jude Children's Research Hospital opened on February the 4th of 1962 and was founded by the late entertainer Danny Thomas. Its mission is to find cures for children with cancer and other catastrophe diseases through research and treatment. St. Jude has treated children from all 50 states and from around the world. On average, 5,700 active patients visit the hospital each year, most of whom are treated on an outpatient basis. St. Jude has 78 inpatient beds and treats up to 230 patients each day. St. Jude is the first and only pediatric cancer center to be designated as Comprehensive Cancer Center by the National Cancer Institute. St. Jude is the first institution established for sole purposes of conducting basic and clinical research and treatment into childhood diseases, mainly cancer. Research findings at St. Jude are shared freely with doctors and scientists all over the world. The medical and scientific staff published more than 640 articles in academic journals in 2009. More than any other pediatric cancer research center in the United States. St. Jude's researchers are published and cited more often in high-impact publications than any other private pediatric oncology institution in America. St. Jude is the only pediatric cancer research center where families never pay for treatment and covered by insurance. No child is ever denied treatment because of the family's inability to pay. St. Jude Children's Research Hospital is the nation's top children's cancer hospital according to the 2010-11 Best Children's Hospital Rankings published by U.S. News and World Report. In 2009, Parents Magazine named St. Jude the #1 pediatric center care hospital in the country based on the magazine's survey of more than 75 children's hospitals nationwide. St. Jude has developed protocols that have helped push overall survival rates for childhood cancers for more than less 20% with the hospital open in 1962 to 80% today. The current St. Jude survival rates for selected childhood cancers now include acute leukemia, survival rate 94%, Hodgkin lymphoma, cancer of the lymph system, 90%. Melaplasmy, a type of brain tumor, 85%. Wilms tumor, which is a kidney tumor, 90%. In 1962, the survival rate for acute leukemia, the most common form of childhood cancer, was 4%. Today, the survival rate for this once deadly disease is 94%. Thanks to the research and treatment protocol developed at St. Jude. The daily operating cost for St. Jude is $1.6 million, which is primarily covered by public contributions. During the past 5 years, 81 cents of every dollar received has supported the research and treatment at St. Jude. St. Jude recently completed an extended expansion program that bolstered the hospital's research and treatment efforts while more than doubling the size of its original campus. The campus now has 2.5 million square feet of research, clinical, and administrative space dedicated to finding cures and saving children. The expansion included the Children's GMP, currently the nation's only pediatric research center on-site facility for the research and production of highly specialized treatments and vaccines, an expanded Department of Immunology, and a new Department of Chemical Biology and Therapeutics for discovery of new drugs. The Child Care Center opened in November 2007. Patient care and research were rapidly evolving, and MR technologies keep St. Jude at the cutting edge for radiation therapy. St. Jude pioneered a combination of chemotherapy, radiation, and surgery to treat childhood cancers. St. Jude patients are referred by a physician and generally have a disease currently under study and are eligible for current research protocol on clinical research trials. St. Jude researchers and doctors are treating children with genetic immune defects and pediatric AIDS, as well as using new drugs and therapies to fight infections. St. Jude was the first institution to develop a cure for sickle cell disease with a bone marrow transplant and has one of the largest pediatric sickle cell programs in the country. St. Jude is a World Health Organization collaborating center for studies on the ecology of influenza viruses in animals and birds. St. Jude was the first facility outside the National Institutes of Health to receive federal approval for research involving human gene therapy. St. Jude mission statement. The mission of St. Jude Children's Hospital is to advance cures and means of prevention for pediatric diseases through research and treatment. Consistent with the vision of our founder, Danny Thomas, no child is denied treatment based on race, religion, or a family's ability to pay. The vision for the worldwide advancing treatment and prevention of catastrophic diseases in children will be pursued by providing outstanding patient care by conducting basic, translational, and clinical research designed to understand disease pathogens, improve diagnosis, enhance treatment outcome, prevent these diseases, and minimize consequences of treatment. And why should you support St. Jude? Their supportive care lets you help ensure that St. Jude Children's Hospital will continue its life-saving mission of finding cures and saving children. It costs $1.6 million a day to operate St. Jude, and public donations provide more than 70% of our funding. But the most important reason is, in the words of St. Jude founder Danny Thomas, no child should die in the dawn of life. And how do you do your donations? You can do your donations through the website of St. Jude Children's Research Hospital, donors at stjude.org. They also have their telephone number, which is 1-800-822-6344, which is operated 7 a.m. to 11 p.m. Central Time. Or you can also do it by mail. St. Jude Children's Research Hospital, 501 St. Jude Place, Memphis, Tennessee, 38105. And once again, thank you. And please help support St. Jude.